So how is the patella alta diagnosed? Here also you can see three pictures. First is the normal patella in the groove of the femur. The second patella baha, that is the patella is inferiorly placed or down, and the third picture is patella alta, where the patella is in a high riding position. So since we are now discussing the patella alta, let us continue how it is diagnosed. With proper examination, we have to check the position of the kneecap in relation to the femur from different angles and with the knee in different positions. First is in full knee extension. When the knee is fully straight and relaxed, the kneecap can be moved slightly side to side, and if the mobility is more, if it moves farther than normal, then there is a probability of patella alta. Then second is knee slightly bent position. Patella alta often produces the camelback sign, that is when the knee is bent to around 30 degrees of flexion. When viewed from the side, two mounds are visible, like two humps on a camel. One, the enlarged infrapatellar fat pad, or the infrapatellar bursa. One from the high riding patella pointing upwards, and the other from an infrapatellar fat pad or bursa. Then third is the knee bend. With patella alta, when the knee is bent to 90 degrees at right angle, the kneecap point upwards instead of forwards and may be externally tilted, upwards and externally tilted and rotated, and this is known as positive grasshopper's eye sign. So these are the some positions that we generally see while examining the knee. And already we have discussed the different methods like the Blumenset line, the insole salvetti ratio, then the Blackburn peel ratio, the Caton Disham's ratio. All this we have discussed. So that is also a confirmation when we try these different methodology on X-rays and we confirm that there is the patella alta or patella baha. Then regarding the treatment part, conservatively we try to treat first with rest and from restrain from aggravating activities to prevent any inflammation, or if there is inflammation we give rest to settle the inflammation. Then after the inflammation settles down, we can go for strengthening exercises, strengthening the knee, kneecap and buttock muscles, gluteals, which can help to correct the patella position and thus reduce the pain. The muscles around the knee which keeps the patella in the groove, as I have discussed in my other classes, like the kneecap or the patella is surrounded by four force arms, like first superior and inferior. We have the quadriceps muscle pool, we have the patellar tendon pool, we have the lateral ITB pool, we have the medial retinacular and medial structures pool. All these force act to keep the patella in position. So strengthening of all those muscles and stretching of the tight structures will allow the patella to be in normal position. Also you can go for patellar taping. Then if there is pain, you can go for ice packs and reduce the inflammation. Also wearing a knee brace can help to reduce the symptoms, and if at all the discussed methodologies of treatment fail, then we go for the operative treatment, and we have the tibial tuberosity osteotomy. tibial tubercle transfer is this is done when the patellar tendon attachment is moved down, which is generally attaching in the tibial tuberosity, but in this operation we detach from the tibial tuberosity and we put it down, so that it brings the patella down with it. The Q angle can also be corrected if necessary by moving the patella tendon attachment inwards. Then we have a tibial tuberosity osteotomy is done by removing the tibial tuberosity from the front of the shin bone, moving it down, as I said. Then we have the lateral release. If the tightness is in the structures, lateral structures or outer side of the knee are pulling the kneecap out of position laterally, then we have a lateral release surgery to lose them. Then we have another technique called patelectomy, where the patella is completely removed and it is only indicated when other surgical methods have failed. And after the surgery, following surgery, to recover from the surgery, we advise to wear a knee brace up to 6 weeks following surgery. The brace will limit the amount of flexion at the knee to allow it to heal properly. Also, we can give the patient to use crutch for a couple of weeks so that minimal weight is taken on the operated leg. Then gradually may be able to increase the weight through the leg over the next few weeks. Then gradually you start moving your knee and exercises for the strength, stability, movement and function. So this is about the patella alta, and we have also seen the different measurement methods to locate the patella, that is it is in high riding or it is above. We have seen various methods. So anything, any questions, any doubt, please come forward and I'll be happy to answer them. That's all. Okay, thank you.